What do complete blood count results say about leukemia types? Imagine your blood as a busy city with different types of workers doing their jobs. When leukemia is present, this city experiences a disruption that can be seen through a simple blood test called a complete blood count. This test measures red blood cells, white blood cells, and platelets, giving doctors a snapshot of what's happening inside your blood. It's a crucial first step in diagnosing and understanding leukemia. In leukemia, the white blood cell count often becomes abnormal, but the pattern depends on the type. In acute leukemias, like acute lymphoblastic leukemia or acute myeloid leukemia, the complete blood count usually shows very high or sometimes low total white blood cell counts. This is because there are many immature white cells called blasts that don't work properly. These blasts are like rookie workers who haven't learned their jobs yet and can crowd out normal cells. The presence of these blasts is a key sign of acute leukemia. In contrast, chronic leukemias such as chronic lymphocytic leukemia or chronic myeloid leukemia tend to show an increase in mature white cells. For example, in chronic lymphocytic leukemia, there are often too many mature B lymphocytes, which are a type of white blood cell. In chronic myeloid leukemia, there are too many granulocytes, another white blood cell type, at various stages of development. A differential count, which breaks down the types of white blood cells, helps doctors see which lineages are involved and whether the cells are mature or immature. Leukemia also impacts red blood cells, which carry oxygen throughout the body. Many people with leukemia develop anemia, meaning their red blood cell count drops. This results in low hemoglobin and hematocrit levels, making people feel tired or weak. The reason is that leukemia cells crowd out normal bone marrow cells, reducing the production of healthy red blood cells. The severity of anemia can indicate how advanced the disease is. Platelets, the tiny cells responsible for blood clotting, are often decreased in leukemia. When the bone marrow is filled with leukemic cells, it can't produce enough platelets, leading to thrombocytopenia. Low platelet levels increase the risk of bleeding, which is why bleeding or easy bruising can be signs of leukemia. Both acute and chronic types can cause this problem. Different leukemia types have characteristic patterns on a complete blood count. In acute lymphoblastic leukemia, the CBC might show a variable white blood cell count with many lymphoblasts, along with anemia and low platelets. Acute myeloid leukemia often shows elevated or low white blood cells with myeloblasts, anemia, and low platelets. Chronic lymphocytic leukemia usually presents with high lymphocyte counts, often over 5,000 per microliter, with mature but abnormal B lymphocytes. Anemia and low platelets may develop later. Chronic myeloid leukemia is marked by very high white blood cell counts, especially granulocytes at different stages of maturity, and can also include anemia and low platelets as the disease progresses. While a complete blood count provides important clues, it is not enough on its own to confirm the type of leukemia. Additional tests like flow cytometry, which identifies specific cell surface markers, bone marrow biopsies, and genetic studies are needed to determine the exact lineage and genetic features of the leukemia. These details help guide treatment options and prognosis. In summary, a complete blood count in leukemia often shows abnormal white blood cell counts with immature or abnormal cells, decreased red blood cells indicating anemia, and low platelets. The specific pattern helps doctors distinguish between different types of leukemia and decide on further testing and treatment. Regular monitoring of blood counts is also essential to track how the disease responds to therapy. Remember, each person's experience with leukemia is unique, so always consult healthcare professionals for personalized advice and care.